Hello, dear souls. So I heard you want to join the military. Well, here's what people don't tell you. So, anxiety disorders such as generalized anxiety disorder, panic disorder, and phobias all get worse during the military because of constant vigilance, rigid schedule, uncertainty, high stress environments, exposures, pre-existing fears like heights, confined spaces. Depression and mood disorders get worse as well. You might not think you have any of these disorders, but it's good to know what gets worse. So, major depressive disorder, there's long deployments and isolation from family and grief and feelings of hopelessness. So if you feel like you can't live by yourself, you might not want to go to the military. Bipolar disorder, there's a lot of stress, irregular sleep, unpredictable environments may intensify mood swings. Seasonal affective disorder, or SAD, especially in deployments to regions with large periods of dark or extreme weather, they have really bad side effects. So if you know where you're applying, keep that in mind. So post-traumatic disorder, acute stress disorder, and complex trauma, this gives you risks because, first off, being in the army can traumatize you. And if you already have traumas, it can re-trigger your trauma. It's intensified by combat exposure, witnessing death, surviving attacks. Short-term acute stress disorder can progress to PTSD if untreated. So if you have it, if you have PTSD, then it might turn to CPTSD, complex PTSD, or complex trauma, because it's a repeated exposure to certain events. Like if you have a problem with military people or people in authority, it's not a good idea to volunteer to join the military. There's substance use disorders like alcohol and drug misuse, because it's used for coping mechanisms, stress, trauma, and insomnia. In prescription medication misuse. Sleep disorders, people get insomnia and sleep apnea due to the stress, irregular hours, and unsafe sleeping conditions. So, yeah, they get nightmares and night terrors because they have trauma. Almost kind of done. So, adjustment disorder. So, they're just really running around in the military, as well as coming back to normal life. So, yeah. Personality disorders, borderline personality disorder, antisocial personality disorder, obsessive compulsive personality disorder. All of these may worsen because for border personality, intensified instability in relationships, fear of abandonment. For antisocial personality disorder, higher risk behaviors in combat or unit conflict. This is terminology that's used by the military, but hopefully you understand that they have groups of people that work together and it can be unstable. Obsessive compulsive personality disorder may worsen in highly structured but chaotic environments. Psychotic disorder, schizophrenia, and schizoaffective disorder. So stress, sleep deprivation, substance use can trigger or worsen episodes. Eating disorder, military has weight standards and body images can make anorexia, bulimia, binge eating disorder worse. And finally, trigger warning, suicidality and self-harm risks. This increases in military populations due to stress, stigma around seeking help, and access to firearms. So, can you still join the military? Please think about it. Thank you for watching.